As being from Ohio, we're kind of unfortunately right in the middle of this. And just give you some, sobering statistics that we've had just from overdose deaths. If you go back to 2015, we had 3,050 people lose their lives. In 2016, that number went up by 1,000 to 4,050 people. And just in the period ending from the fiscal year from the end of June of 16 to 17, that number went to 5,232. So we're seeing this horrible increase in the state of Ohio, and also a lot of it's being caused because of fentanyl. And when you look at in 2016, we saw about 58.2% of all the overdose deaths were because of something involving fentanyl. So, as our topic today is on the opioid crisis, but for us in Ohio, we've gone to an epidemic because how bad it is out there. And if I could, because it's important, because I know that there's a little bit of discussion that you've had already talking about drug take-back days and things like that. I've participated in two in Lucas County with the sheriff. I was absolutely astounded at how much came in that day. And then I was with the Findlay Police Department, another just south of there in my district, on another drug take-back day, and the amount of drugs that were taken back that day. So, there's things happening out there, and it's important, but I'm also working with legislation on getting the information out for my communities, and it's the Info Act. Because one of the things I've heard from my communities out there, because I represent a lot of small areas, and the problem is that they don't have the grant writers, they don't have the information, they need to have some place they can go to get the information, what's happening on the federal side, and also, just as importantly, where the money is to help. So, we've been working on that because it's very, very important. But let me ask you, because in your testimony, again, it's just this data information back and forth, but in your testimony, you talk about the heroin fentanyl task force, which is the intergovernmental working group. And you have a lot of, law enforcement, Homeland Security, investigative, postal, even Defense and Intelligence Agency. Is it an oversight, or is HHS not part of that working group?
Sir, which working group?
Okay, this is the heroin fentanyl task force that you mentioned in your testimony. I did not see that HHS is not in that group.
Sir, I would have to get back with you exactly what their role would be, but I know for a fact anything that comes across my desk, I reach out for HHS immediately because they provide the scientific expertise that I need to get this job done. I have a lot of experts at DEA also, but we work hand in hand with them. So even if it's not listed, we would be more than happy to partner with anybody.
Well, if you could just tell me if they were in that working group, that would be important. Let me go on, because again, when we're talking about fentanyl, and when you're talking about the importation, especially from China, and again, I've had meetings with my 14 county sheriffs and conference calls, and meeting with them personally, and also with my police chiefs across the district. One of the concerns out there, what's happening is we're seeing that fentanyl is now being laced with marijuana. And not specifically in this case, but a young individual died in my district recently from about fentanyl about the size of 3 grains of salt, and that took that person's life. And so what is DEA trying to do right now, trying to stop the importation? I know a lot of it's coming across the mail. You brought up the fact about how, it's $3,000, $4,000 and how much you can get on street level, out there on the street with it, over $1 million. But what is the active role DEA right now is taking on stopping that from stopping the fentanyl from coming into the country, especially from China, or if it's being sent to, Mexico or into Canada and somehow getting brought back in the United States? But what exactly are we doing at DEA?
Sir, I appreciate your question because I'm really proud to be sitting here saying that our DEA Beijing country office works closely with the Chinese government. China has been a very good friend to us in the fact that they have put 138 new psychoactive substances. They regulated them over in China for us, and they're not even a problem over there. And statistics have shown if they regulate a substance over there, it has a direct impact on law enforcement encounters. It dramatically declines. So DEA, we're very present in a lot of foreign countries that I'm very proud of, And I think our job starts thousands and thousands of miles away from the United States borders, and I think that's just one example of it. And we're really appreciative for anything that the Chinese government can do regarding regulating those substances.
Mr. Chair, my time's expired.
Gentleman yields back. Chair, thanks.